Anytime you have surgery, there are always risks with surgery, but surgery doesn't necessarily have to be uncomfortable, and it certainly doesn't have to be painful. There are lots of steps that people can take in order to make sure that they don't have pain. I think it's extremely important to make sure somebody doesn't have pain. There are a number of ways to make sure that you have the least amount of discomfort possible. I actually worked in research when I was in residency to determine and come up with a way to control people's pain after surgery without giving them tons of pain medicine. And we developed a way to we adapted some techniques basically from the spine surgeons and from anesthesiologists using epidural catheters actually in the foot instead of the back to keep that area numb after surgery. It's very low cost, it's low technology, it's not expensive, it doesn't cost you any extra. We always do that for free, and we include it with our bunion patients because it's critical to make sure that you don't have that additional discomfort. There's no reason for that at all, and we make a really significant effort to do everything that we can to control your pain. We use lots of therapies that other doctors don't use, including putting a catheter under the skin to make that area stay numb for several days. We use cryotherapy in order to reduce discomfort, and all of those things are technologies that have been adapted from other specialties and are readily available, and it's oftentimes baffling to me why everybody doesn't do that. It's not that we're trying to keep that a secret. In fact, we actually published the research in a journal called Ambulatory Surgery, which teaches other foot surgeons how to do exactly what we do. Anytime I get an email from another doctor who wants to know how to do it, I send them all of the papers, I send them all of the technique about how to do it, and I oftentimes correspond with them a number of times after they've tried it to make sure that they're doing it correctly. And that's the thing, is I don't understand why it is when there are technologies available to reduce people's discomfort, not everybody utilizes them. And like I said, it's not something we try to keep a secret. Yeah, it's extremely effective. In fact, in the study that we did and published in Ambulatory Surgery, 57 out of the 58 patients believe that it significantly reduced their pain. We had many patients that took no pain medicine whatsoever. They all had good pain control, and every single one of those patients would choose that technique again if they were going to have elective foot surgery again. No, it's local anesthetic, and it's only in that area, so it keeps that area numb, and it's not a thing where they have to take medicine or more pills or injections or anything like that. It's nothing like that at all, so it's a very simple technique that just makes their foot more comfortable.